The Dubin Breast Center means different things to different people.
I would describe the Dubin Breast Center as miraculous.
You're entering a place that is, in a way, the temple of medicine.
I think what I didn't realize when I was starting on this journey, that it's not only the treatment itself that's so important, it's all the different people that come together and help you to win each fight in this war.
Mazel tov, mazel tov.
The cancer diagnosis is life-changing, but there were so many other things going on in my life at that time that I cared about as well. When I saw Dr. Anderson the first time, he was like, well, right now we're waiting on one more hormone receptor, and if that's positive, then you're gonna have to have chemo. And then I was like, no, I'm not losing my hair. I won't do it. I won't get married bald.
I think cancer care can be not only the science of it, but also the personal human aspect of it. You always want to try to put yourselves in the shoes of your patient. It's very important to keep in mind, how do they feel during this?
I was ready to push the wedding, and he's like, you're not pushing your wedding. What are you talking about? There's no need for that.
We talked about what the options are in terms of preventing hair loss. We have a great program here for cold capping, which has been shown to prevent hair loss due to chemotherapy.
He talked through those things with me. His confidence that he could get me there in the way I was imagining was so clear that I didn't question after that whether I should push the wedding.
Some doctors, you're just like, okay, they're a great surgeon and that's all I care about. It becomes more than just a patient-doctor relationship because there's so many personal components that go along with it.
Donna shared with me that she had a dress picked out, the date was set, everything was planned, and we wanted to make this happen for her.
I needed to have surgery, but also the dress had been ordered so long ago. What does it look like? How is it gonna fit? How was I going to be the most comfortable dancing and enjoying the wedding? He walked me through every step of it, not only with his words, but with his actions. The hand-holding, the feeling that everything's going to be okay now, in a very meaningful and gentle way that makes you take a deep breath and say, okay, it's gonna be okay.
What I think we've become is just the ultimate patient-centered environment, providing each specific treatment or component of care that an individual patient needs.
I don't think you could encapsulate what the Dubin Breast Center does in one word. They do too much. I was so grateful that I got into this family, because it really does become your family.
We're the center that provides the life-saving clinical trial. We're the center that provides incredible medical care. We're the center that provides a comprehensive BRCA program, screens patients with genetic mutations to prevent those cancers or to pick them up early. We're the center that provides cold capping to prevent hair loss during chemotherapy at no charge.
You don't live for other people, but you do. I did what I had to do. I was fighting for the baby I was pregnant with, who I'd never met yet.
When Williana told me her conviction that this pregnancy meant everything to her and that she was going to maintain the pregnancy, my response was, I will do everything that I can to enable you to get the treatment that you need for your breast cancer in a way that we can maintain the pregnancy. And it did require some creative thinking.
The creativity came in the fact that we didn't follow the usual playbook. We sort of had to mix and match and use different therapies during different parts of her cancer journey.
This is something that cannot be done at a hospital that only treats cancer.
The optimal management of breast cancer requires a multidisciplinary team that includes not only individuals with expertise in the management of breast cancer, but also high-risk obstetrical care, as well as potentially pediatric care. And so that requires really a very sophisticated healthcare system that would allow one to deliver that care in a coordinated and multidisciplinary fashion.
They finally gave him to me. It was the most unreal moment of my life. He came out the most perfect, wonderful, amazing little person on the planet. I would consider Dubin my blessing. I definitely think it was. I think this place was precisely where I needed to go.
Research is so important for us at the Dubin Breast Center because we need to know that the next generation of patients will receive even better options and better care for their cancer. My particular focus has been on triple-negative breast cancer, and we're looking at what drives metastasis on a cellular and molecular level.
What we do nowadays is completely different from what we were able to offer 15 years ago. Over the last decade or so, we have developed a very large menu of clinical trials that treat every stage of breast cancer and every subtype of breast cancer. And having a large menu means lots of options, all for the sake of giving our patients as much hope as we possibly can.
Artificial intelligence can sometimes find cancers that go beyond the limits of the human eye to detect. It will mark something that we cannot perceive. The best radiologists cannot perceive it. But when artificial intelligence marks it, sometimes it finds a cancer before the radiologist can.
When we created the center with the help of Eva and Glenn Dubin, there was the perception that there was not a breast center that provided holistic, compassionate care.
From now on in my life, I belong to the Dubin Center. For anything related to the breast cancer, I don't have to go anywhere else. It's all there.
It is what I envisioned, but it's also more than I envisioned.
And so with her partnership, we have been able to develop the Dubin Breast Center that realized that dream.
Dubin Center is a place of happiness. You receive the love and affection that you wanted.
I didn't realize that we were going to be so sought after, not only on the northern part of Manhattan, but across this country, even overseas.
Dying is not an option when you're a mother. I had my lumpectomy in London, and during the recovery period, I decided to move to Dubin Center for treatment. It was very important to keep my family together. I have 3 small children, and I wanted to keep all of us together. They were the driving force behind my positive mindset. I had such confidence in Dubin Center. I didn't really need to remind myself that I was going to be fine. to everyone at Dubin Center, thank you for allowing me to have the journey that I had.
Being a male, I'm kind of unique. It's gonna sound kind of strange, but it's like, okay, I came to the right place, and that was the feeling that I got. Dr. Port had a vision of how to deal with this, and that's what I wanted. I felt like, hey, I'm in great hands here. I'm a really lucky guy to be working with the best.
Prior to cancer, I was an avid runner. I had several marathons under my belt and triathlons under my belt. And so Dr. Anderson knew how important my fitness levels were to me and also encouraged a more holistic approach. He encouraged talk therapy, he encouraged acupuncture. Little by little, I started to walk 30 seconds at a time, run 30 seconds, walk 30 seconds, and eventually found myself training for the New York City Marathon again. The Dubin Center is located at mile 23 of the New York City Marathon. Mile 23 is also a 1 mile incline. I could not feel that incline. My heart was filled with so much joy. And every year there's a bunch of nurses and hospital personnel that comes out to cheer. And every year I stop to take a picture with them and I tell them that I just beat cancer. This is not the end. It might feel like the end.
Bring that bell.
This is just a bad chapter, but there's another chapter coming, and there is truly, truly more life to live after cancer.
I think it's so important for our patients to tell their story because they're our inspiration for coming to work every day, for continuing to do better, and to celebrate the incredible achievements of the Dubin Breast Center and the care that we've given.
You not only saved my life, you saved my family. You saved us.